Okay, wonderful. So everyone, this is Captain Kelly Elmore. She's a native of Chicago and received her medical degree from the University of Chicago School of Medicine, as well as she has a master's in business administration from the Naval Postgraduate School. Please forgive me if I keep pausing. I'm just admitting people from the waiting room as well. So she has held numerous positions throughout her Navy career, including the department head of OBGYN, which is now GSNO, at Naval Hospital Camp Pendleton in Guam, and she's been the director of healthcare business I know definitely at Naval Hospital Camp Pendleton. Currently, she is serving as the interim executive officer at Naval Medical Center San Diego, and she has been responsible for numerous improvements to healthcare services, including creating an in-hospital natural birthing center, developing cross-health service partnerships with the VA, Army, Air Force, and public health. She was also the physician liaison on the island of Guam, Japan, and Puerto Rico. She has numerous military awards, but she's also been honored with the Military Health Service Navy Female Physician Leader of the Year, the Women of Color and National STEM Award for Military Scientists. Thank you so much for being here, Captain Elmore. I really appreciate it. And I will start with a video that she requested that I play for everyone. So hopefully the sound works. If someone could just let me know if they are seeing my screen.
We see your presentation.
Okay. And hopefully the sound goes through as well.
Good afternoon, good morning, good evening, wherever you are in the United States of America or around the globe. We are so happy to have you here. I'm going to let her set up that video, but I want to say first, thank you so much for that wonderful introduction. Dr. Nkalawi, we have worked together since we are both at Camp Pendleton. The moment she walked through the door, I completely admired who she was. She has been somebody that is a boss in pediatrics, but also has been an advocate, has been a community partner, has gone overseas, done humanitarian work. So I just want to say thank you so much for thinking of me and bringing me to the stage. It is so important that we have these conversations. And also the other thanks I want to give out, my PAO, my triad, the admirals, and all the people specifically from the Mighty Medical Corps, as well as my friends from the Nurse Corps, MSC, my corpsmen, as well as my colleagues, family, and friends who have got me to where I am today and who have listened every time I spoke and who have worked with me to change the landscape of women's healthcare. I also want to give a shout out to our specialty leaders in GS&O, so gynecologic surgeons and obstetricians. We actually had a new article come out in the Stars and Stripes. So I want to give a shout out to our specialty leader who past and present, who continue to move things forward. Dr. Nkalawi, is that video ready or no?
I believe so. Are you able to see my video right now or no?
I'm not able to see it.
Okay. How about now? Can anyone see the video? My screen? Let me just double check that I'm sharing my screen. Yep, it says that I'm sharing. Oh, you're still seeing my PowerPoint slides. Give me one moment. I have it all teed up, but I have to unshare and then reshare. My apologies.
And then also the chat is active, so if you have any questions along the way, if you have questions before we start, as I said, I'm very interactive. So I love to have questions, have conversations with people so that we can really make this what you need, which is a value-added presentation. If I'm here speaking and I haven't added to your day, then I shouldn't be speaking at all. So let's go ahead and do that. I'm ready for you, Dr. Nkalawi.
All right. Can you see my screen now with the video?
Yes, ma'am.
Okay, wonderful. Here we go.
We don't hear sound, though.
Oh, you can't hear sound? Oh, no. I'm not sure how to share the sound. I'm sorry.
No worries.
Anyone else on the line know how to share sound with videos?
No worries.
Okay, I can try calling in and then, here we go. I'll have it. Do you want to start your lecture, ma'am, or do you want me to keep working on this?
Yeah,
Okay, I will. You can always play it at the end. I'll try to work on it.
absolutely, no worries. All right, everybody. So as she said, I'm Captain Kelly Elmore. I'm better known as Dr. Kelly OMZ. I'm all about encouraging, educating, and inspiring as many people as possible across the globe to live their best lives. And the reason why this is important is because as we talk about, and I initially said this lecture was called Fighting for the Female Warrior, but it's really about advocating for the female warrior. Because you know what? We already know how to fight, and we should not have to fight to be here. When I first came in in the Navy at age 21, my goal was to do like many of us, to pay for medical school, serve 4 years, and then go on to be a gynecologic surgeon and obstetrician. But in those 21 years, in my 20 years that I've been here, I understand that I am also a part of the 10% of military families that recruits from our military families. So I'm a part of that recruitment. I'm a part of that retention. And so are you. So despite the differences of how I grew up or where I grew up or where you grew up or what's going on in your lives from past, present, and future, there's so many commonalities that we have amongst us. And it was those commonalities that my ancestors, that my brothers, that my father bestowed upon me that said, you know what, as we're sitting at this kitchen table, you know what is important? It is important that we give back to our country. And I knew that I wanted to give back to my country, but I didn't know how I was going to do that. My focus, as I said, was to be a physician, as many of focus you have as well. But I didn't know, okay, was I supposed to be a sailor? Was I supposed to be like literally out on the seas? Was I supposed to be on the ground? Was I supposed to be, in a building, in an MTF, in a hospital? Was I supposed to be in a clinic? I did not know that. But being exposed to the military has given me so many options, and just as it has given you, that we're out on the ground, we're in the seas, we're in the air, we're in space. I mean, this is amazing that what we're doing, what we're able to be a part of. When I came in, I was financially poor, but I had big ideas, and I was excited to make an impact on women's health care. That impact on women's health care started because I came from a family where women were abused, where women had been raped. I came from a family also that I had women that had significant grit and resilience. I came from a family where a grandmother who only had an 8th grade education found between her sisters how to work together within the confines of our country. And we all know that there are some confines of the country that Black women have to deal with, but they were able to bring forth a legacy of wealth and understanding and spirituality and being able to have high emotional intelligence so that they would be able to be successful. And I wanted to be able to carry that legacy on, but I wanted to carry that legacy on not only in women's health care, but I wanted to carry that on in the United States Navy. So when I put this uniform on, when I was a young, tender age of 21, and I actually have that picture, my first picture, and when I look over to the right and I look at the picture today, not that I look that much older, I am so proud to stand here before you as a member of our medical corps. I also wanted to had to understand as a medical student that I was the next generation of advocates. It's really important for us to understand that the people that are in our sphere right now, whether those people are, junior sailors, senior sailors, junior officers, enlisted, if they are in our corps, outside of our corps, whether they are in our Navy, Army, Air Force, Coast Guard, or our reservists, that these people are a part of the next generation, and it is our requirement to educate them, to encourage them, to inspire, not only to come in, but to stay in, and when they're here, to find passion and purpose in everything that they do. In residency, I had the most amazing residency as an OBGYN. I trained here at Naval Medical Center San Diego, and coming back has been such an amazing experience, seeing the full circle, seeing what the training brought to us at this MTF, world-class, world-renowned training. And it's not just at NMCSD, it's at Portsmouth, it's at Camp Pendleton, when we have programs at Bremerton on the northeast coast as well. We have world-renowned training, and we need to be able to keep that. But I didn't understand who my, customer really was, is what I'm going to say. I understood that I needed to take care of women, but I did not understand that I needed to take care of active duty women to a whole nother level than I took care of other people, other, retirees, other beneficiaries. Not to say that our retirees and our beneficiaries are not important, because they provide a fabric of our training, of our education, of our knowledge, skills, and ability that we just cannot do without. However, the female warfighter did not come to mind as the person that I was supposed to be taking care of to the first degree. And the reason why that was is because as a resident, all I knew was whomever walked through the door, that's who I needed to focus on. But as I traveled the world, I came to understand that our female warfighter is the one we need to make sure is ready for the fight, not only tonight, but each and every day. And the only way that we could go ahead and do that and understand that we do that is, number one, to get out there and ask those questions. Go out to the ships, go out to the field, go overseas, go, into the MTF and ask. And not only ask people that look like you, that do the same thing as you, but ask people that do something different. Ask your enlisted personnel. Ask them, what are you going through? What is going on? When a woman comes into my office to have a clinical appointment, you know what I ask her? How is your emotional, spiritual, mental, physical, and financial health? And you may ask me, how do you get to ask all of those questions in your 7-minute appointment? Well, you know what? Those 7 minutes can be so filled not only with clinical, but the things that I asked about, that I get to complete my entire appointment as well as my note and have so much to add to that. Because the importance of making sure that you ask all of those questions is, the female warfighter is a whole person. You are addressing the entirety of this woman. So all of those things together helped me understand, whether it was at NMCSD San Diego, Naval Hospital Camp Pendleton, whether I was in Puerto Rico, Guam, Japan, whether I was in Fiji doing humanitarian work, whether I was in D.C., it did not matter where I was. If there's one thing I want you to come away from this, I want you to ask every single person, specifically the women, how is your emotional, physical, spiritual, mental, and financial situation? Do you feel safe at work? Not safe from the standpoint of, do you feel like somebody is going to harm you necessarily, but do you feel safe to speak up in your space? Because when she speaks up in her space, that means that we're making a difference not only for her, but for everybody else. So when we talk about the question of why, and I can't see the screen to see what slide we're on, but when we talk about the question of why, does anybody have any understanding of why this presentation is important? Why advocating or why fighting for the female warfighter is specifically important? You can unmute your mic. You can chime in on the chat. Nobody? Well, I know there's a lot of women on here, and I know there's a lot of men. So the why for me, women are necessary for continued innovation, superiority, and lethality of our military forces. When you have a woman's mind sitting at your table, you have diverse thought, you have diverse experience, you have diverse understanding, and I'm going to be, quite honest. We are able to run multi-million-dollar households with multiple tasks and still get it done. Not to say that my male counterparts are not able to do the same thing, it's just done in a different way. The service to our country is open to everyone and anyone who qualifies and is willing to make that commitment. So we have women that are coming in that are willing to make the commitment to our country. And we need to be ready to help them understand, especially if they're coming in young, to grow in this organization. If we can think about it, some people are coming in at 17, 18 years old. If you're a physician and you went the traditional track, you may have gone to college, been to med school. Imagine how much growing up had to do during that time. And we need to help people mature into our organization. We need to help people understand the ideals of our organization. We need to help them understand how do you operate at the high level that we expect you to, as well as continue to move forward in your education. Encourage others to do the same so that we can be a superior medical fighting force. So as medical physicians, we need to think about that as well. Looking at, okay, this person came into our service. What can I do to help them to succeed and get to their next level so that when they do take care of that patient is a collaborative effort with them so that they understand, so that they can be empathetic or sympathetic to what they're going through, so they're not just another number, and understand, you know what, they may be young in age or young in this organization, but I've got to help them keep moving forward. Also, I mentioned before, we need to look at the female as a whole person. It's not just about her uterus. It's not just about keeping her from getting pregnant so that we can make sure that our unit sticks together. We need a whole person viewpoint. So that means from the top of her head down to the sole of her feet, physically, mentally, spiritually, emotionally, and financially, we need to make sure that she is taken care of and has the resources that she needs. And lastly, if you do all of these things, I can tell you numerous people that and I'm sure you have been able to recruit, as well as when they see you doing all of these things with them and for them, they want to stay in our military. They want to stay here because they feel purpose. They want to stay here because they know they are getting a great education. They want to stay here because they love what they do, who they do it for, and who they do it with. Next slide. Anybody have any feedback or questions about that? So, in this I ask, who am I, who are you, and who are we? So when I put down who am I put this from my perspective. I'm a woman, unapologetically a black woman. I'm a wife, I'm a mother, I'm a daughter, physician, healthcare executive, officer, active. Soon, some of us will be veterans, and veterans may be listening now. I'm a community advocate, and I'm an athlete. I'm not an athlete just because I'm in the military. I'm an athlete because I grew up as an athlete. And really, I'm a ball player, so that's the athlete for me. But when we think about how we treat and how we think of our female warfighters, we need to look at this side and say, okay, how many of these things do I have in connection with you? Because this is so important, because if we're talking about letting go of biases, getting rid of discrimination, getting rid of racism, because these are all the things that when women come into my office, this is what they say they're experiencing. And I'm not just talking about my black patients. I'm talking about all of my patients. They feel like, you know what, I'm not being heard. I'm not being understood. I can't trust anyone. Well, you know what, if they can't see themselves in you, then it's going to be hard for them to take on your recommendations for medical care. So when I say, who am I, and I ask, who are you, how are you and I similar? Because one day I might be your patient. And if I can look at you and I can see you behind the color of your skin, behind your gender, and I can say, oh, okay, you were stationed in Japan. Awesome, I was stationed in Japan. And now we have some commonality. Oh, okay, so your parents live at home with you, or you take care of your parents as well. So you understand when I say I have to take my 81-year-old mother to do this, you understand that I'm going to need that time off. Because I might not have a child, but I have an 81-year-old mother. And although that person is not my child, that's my dependent. And I need to be able to take that time without you looking at me in a way that's inappropriate. Also, we have veterans. We have active duty women. And we need to make sure that we don't forget when we come off of active duty that our veterans are here supporting us as well. Because many of the people, like in my director of healthcare business, most of my directorate are prior military. So I can say to them, oh my goodness, you know, you've been here, you've done that. What was your experience? And the reason why I'm giving you all of this is because this is how we look at people past their gender, and this is how we look at people so that we align with what their experiences are. So when they come in with abdominal pain, we just don't put it off as, oh, they're trying to get out of work, because that's not what's going on. There's more behind that, and we need to understand all of that so that we can render the highest and the most safe evidence-based care without judgment. Next slide. So who is the female warfighter? When I looked at this before, I was like, I didn't feel like I was a warfighter, right? When I was going through residency, I didn't feel like I was a warfighter. But you know what? It's many different things. It's a soldier, a sailor who's engaged in combat. It's a person that's a member of the armed forces who has deployed to an area of conflict. And I say anybody that has deployed, gone overseas, PAD, whatever you've done, if the military has asked you to do it, you're a warfighter in some way, shape, or form. Now, you may not have taken a bullet or been on the front lines, but you're on the back lines. And like I tell my OBGYN, or excuse me, my GSO partners, when we save a mother's life from hemorrhaging, we're fighting the war. When we save a baby's life because we've made the right decision to deliver at the right time, that is a future sailor, soldier, or air person that is going to be in our future military, that will look back and say, I delivered here. So when I think about this, when I think about this slide about, okay, who is the warfighter? Who am I? I think about, I am a warfighter. She is a warfighter. It doesn't have to be that you have to be at the front line. It doesn't have to be that you have to carry a gun. Anybody in our organization that takes the call and is willing to say yes when needed, whether that's for COVID-19, whether that's for being out on the Mercy, whether that's for going to Iwakuni in a small place, whether that's for going to Diego Garcia, it doesn't matter anywhere in the world that the Navy or the military services is calling you, you are a warfighter. And this is important because we have to add the female into this. We have to help her understand you are part of the fabric of this nation, and we need you to understand your purpose and the plan. We need you to be one of our people who stands on the platform that elicits medical superiority and power. Next slide. And we all know who an advocate is, but in case you don't know, it's somebody that speaks, pleads, or argues in favor of. And that's what I do as an OBGYN. But when I was sitting there as an interim XO, you have to think bigger than that. And I want to thank my triad for that opportunity. I'm back in the DHB seat, so my advocacy is different. Your advocacy is for wherever you are and wherever you decide to be. And we need you to understand, as medical corps officers, you are a part of how we're going to make sure that our sailors and soldiers, airmen, specifically our women, are well taken care of so that they can go ahead and fight for us in whatever platform they're in. And so that means that every medical corps officer is an advocate, because we took the oath to advocate for our patients, to provide the best medical care possible without judgment, without bias, without discrimination. Next slide. So I want to show this slide, and I'm not sure any people who are on the line or not, visually watching, but if you look at the Navy and Marine Corps Public Health Center, there is a page called Women's Health and Readiness. This page is absolutely amazing. When I was coming up, I couldn't find most of this, except for in my American College of OBGYN's literature. But as we are changing the shape of our force, everyone, I don't care if you're primary care, family medicine, internal medicine, GS&O, general surgery, rheumatology, I don't care how specialized or not specialized you are, everybody needs to have this webpage on their favorites, and they need to make sure it's on their phone. If you look at it, it talks about contraception, menstrual management, pregnancy, as well as, what do you need to do for mental health, general women's health, as well as deployment, policies, anything and everything you have a question about, it's right here on this page. Next slide. Some of the statistics, who you're taking care of. 234,121 women as far as April 2021. And I need you to understand that there is going to be a female that comes into your emergency room, as you know, comes into your office for primary care needs, and you need to understand that that is head-to-toe care of a female. Also going to come into your office as a mental health provider, as well as a GS&O, as well as a general surgeon, a rheumatologist, and we need you to be able to take care of this entire female. Just because we're only 17% of the population of active duty enlisted officers, cadets, and midship people doesn't mean that we deserve anything less. And we need to make sure that we take that seriously. I also put up here how many women we have by rank. So as I mature and being an 06 and above the age of 40, there's a different set of rules that women have for that as far as the physicality. Things change just like in men. And we need to understand what those changes are, and we need to be able to address those changes for them. Because as we can see, we are increasing leadership in our senior levels, and we need to be able to take care of our senior levels so that they can be in the right place, the right mind, the right physicality, so that they can take care of their units, their MTS, and wherever they are. Next slide. So I'm going to go through the top 6 healthcare resources that are needed to become and always remain ready. We don't get ready. We are ready, and we are always ready. So we want to be brilliant on the basics. We want to supply equitable access to highly qualified, culturally competent, and diverse healthcare professionals. Let me be clear. Highly qualified, culturally competent. We have so many diverse ethnicities and cultures in our military. We need to be able to be read in on those. When you go to Guam, when you go to Japan, understand the culture. Understand the people. Understand where you are. We are not there as saviors. We are there to understand. And the better we do that, the better we will be able to diagnose and treat our patients in the way that they need to be understood and taken care of. Next. So what basics do we need you to be brilliant on? We need you to be brilliant on gynecologic care. I know everybody focuses on contraception, and I want to give a shout out, like I said in the beginning, to those who have opened up contraceptive walk-in clinics. These clinics are crucial because they are gateway. They are gateway for us finding out with women what else is going on. And having these clinics available are crucial to making sure that our women are taken care of, not just in the MTF, but out there on the front line, out there in the waters, out there in the sand. We need to make sure that we keep that going. We need to make sure that we can do basic fertility workups, understand the menstrual cycle and what is abnormal and normal. We also need to help them with family planning, as well as fibroids. Fibroids are active in 60 to 80% of women, and even more in women of color, as well as endometriosis. And these are things that are affecting our women significantly. These things will take you out if we're not able to help them understand what is going on, diagnose, and treat in a quick and appropriate manner. Mental health care. Everybody thinks about the psychologist, and I'll be honest with you. I have a psychologist and a psychiatrist on speed dial. And that's not just because I work in healthcare, because it is important. Because when we are in these specifically medical, and when we're in medicine and we're taking care of people all the time, and then as you go into leadership, it's just so important that we make sure that our mind, spirit, and emotions are taken care of. Because if we don't do that, how can we pour into anybody else if we're not fully poured into ourselves? And when you start recognizing that things are not right for you, then you can also recognize when that's going on in someone else. We need to make sure at all levels that we ask those questions. How are you doing? How are you emotionally doing? How are you spiritually, and how are you mentally doing? And be able to have the resources available. It's not always a consult or referral to our psychiatrist. It a lot of times is our psychologist, and many times it's you. You taking the time. We also need to eradicate sexual assault and harassment. This is not okay. Absolutely not okay. And I know we know that, and I know we have our ribbons that we walk around with, and I know we have our protocols about how to report, but we need to do things where it doesn't even happen at all. And that goes back to raising our children appropriately. It goes back to understanding that power belongs to the female or the person, because I know men get sexually assaulted and harassed as well. We need to make sure that we have programs and resources available so that we don't even get to this point. And if we do get to this point, we take care of it. We don't brush it under the rug. Obstetric care, that's a basic. If you are family medicine or you're OBGYN, this is a basic. Even as primary care, the diagnosis of pregnancy is basic. It's a positive HCG. And knowing what to do from there is quite important. At least getting the basic labs and getting them set up with a first trimester ultrasound, crucial. But also, when you're a primary care physician or an OBGYN, understanding that there are risk factors that are associated with this that go back to making sure we have great nutrition to decrease diabetes, to decrease obesity, to decrease the risk of hypertension. These are the three things that are going to affect our women, and we need to take care of it. Musculoskeletal care, fitness programs, and properly fitted uniforms. I cannot say enough about our War Ops program. We have a program here where you're able to get here at 6:30 in the morning and have a workout with a physical therapist, a nutritionist, as well as other, specialists that you need in order to stay in shape, to get in shape, and be ready. And lastly, we've already done this in that website that I've told you, continuous updating of the parenting and family planning guidance. We have meal-to-meal couples. We have, single people. We have single mothers by choice. We have a lot of different people in our ranks that need to make sure they have the resources. We are unable to keep people in just because they don't have the correct resources. I myself was a GO bachelor, pregnant in Guam, by choice because my husband had a great job here in San Diego. We worked it out, but it was not without trying to figure out how do we provide child care on an island that I knew no one. So that's how I came up with the birthing options. That's how we increased the lactation consultations. That's how we increased the mother-to-baby information and created a tribe, a group. Next. Next slide. Maybe not. There we go. So I just want to go over a couple highlights for our 2020, things that we've done around the globe. So like I said, the Deployment Readiness Education for Service Women Handbook, this is amazing. You can download it right to your phone. Every single female that leaves, really that's in the military should have this, but especially prior to going on deployment, so crucial. The Women's Healthcare at the Waterfront program, whether that's on the East Coast, on the West Coast, now in overseas, we got to make sure that we are bringing health care to the women where they are. Very difficult for them to come off the ships or come out of the sand. And we have to make sure that the access to care is right so that we can make sure that they get in when they need to be seen, not when we think it's good for us. We have to make sure that access is good for them. Any woman should be able to walk into almost any appointment within 24 to 48 hours if she needs it. And if she's able to make future appointments as she needs those appointments. And we need to be able to be flexible so that we can communicate with them. The great thing about MHS Genesis and secure messaging is it didn't matter where my patient was in the world. If she needed me, I could communicate with her. So crucial. Also, virtual appointments. When we were in COVID, contraceptive care did not stop because we had virtual appointments. We could figure out, okay, let me go ahead and put this medication into you. And it was like, oh, you don't need a PAP. So you don't need to do that in order to get your contraception. The other thing, virtual appointments for menstrual care. There's so much you could do online for patients just to help them get through their menstrual cycles. Very great opportunity and options for them. And like I mentioned before, the war ops, having this exercise program was amazing. When I was going through COVID, when my teammates were going through COVID, we worked through this program so that we could stay in shape. But more than physical shape, it was mental and emotional shape. So I could be ready, so that I could come in here to our jobs each and every day. Everybody that was involved. I met enlisted people that were junior sailors, senior officers, and junior officers, and we bonded together. And that is what kept me going through COVID. Next slide. So in order to be medically superior, what do we need to do? We need to be brilliant on the basics. We talked about that. That's in my slide deck. We need to listen and not be afraid to make change. We need to stomp out bias, discrimination, assault, and racism. And we need female and male advocates to remain in the fight, whether you're active duty or you're a veteran, whether you're in combat or non-combat. We need you to make decisions and render the highest quality of care that's equitable, that's safe, and that's evidence-based. And we need to make sure that we utilize the 4 Ps anytime and everywhere. Next slide. Lastly, I have a couple of slides on advocacy and policy resources. And you can see these here between our BUMED, the Office of Women's Health, between our Female Force Readiness Advisory Board. And I have to give a huge shout out to the Female Physician Recruitment and Retention Council. This council has definitely helped me along my entire career, and I know it has helped so many women. Having these symposiums every year makes a huge difference. As well as the FRAB, being on those boards makes a difference in the policy and everything that we do. And the Office of Women's Health, I can't thank you enough for all that you've done. There's many more that's out there, but what's most important is that our senior leadership keeps the doors open so that we can continue to move forward. Because you know what? What we can do for the 17%, we can definitely do for the 83%. What we do for the 17% makes it better for the 83%, which makes it better for us all. Next slide. I just want to say thank you for this opportunity. I can't see the chat, so if anybody had anything, any questions, please, by all means, please ask. I hope this was value added. You can add a thumbs up or a thumbs down, or you can email me personally. You can reach out to me directly by email, or as you know, LinkedIn, Facebook, or Instagram. Thank you very much for this opportunity.
Thank you so much, ma'am. I had to turn off my camera. Can everyone hear me now? Because before I was talking and I realized that I was muted. So my apologies.
Oh, right.
I'm guessing. Are you able to hear me, ma'am?
I can hear you.
Oh, okay, wonderful. Okay, I'm going to stop sharing then right now. Here we go. All right, wonderful. So are there any questions from the group? Well, I have a question. I'll start out then. Ma'am, thank you so much for giving this wonderful talk. What a fantastic lecture. It was really fantastic. One question I have is kind of the balance. So obviously for those of us who are not GS&O specialists, I saw the website obviously that we can utilize to help our female warfighters when we're out in the field. But for those of us who may be in other specialties, how do we balance helping out our female warfighters with the challenge of kind of the pace of clinical medicine, outpatient medicine? For example, how do we balance having the time to ask and ensure that our female warfighters are their whole self is doing well with having only 15 to 20 minutes per appointment?
Right. So this is a part of creating a relationship. So I know you're a pediatrician, so you have that relationship with the parent. You gotta have a trusting relationship with the parent in order for the parent to even agree to what you're saying that they should do, right? And it's for me, as I'm examining whether it's a baby, you know, not a lot of times, but if somebody brings their child in and they're like, can you take a look at this? And I'm sitting there, I'm like, oh, okay, what's going on with the baby? But as I'm examining a patient, I'm asking these questions. So it only takes a minute to ask that, and we've done the actual research about how much time the physician is actually spending with the patient asking questions versus how much time the physician is taking on those notes. And the time that we actually spend with the patient is much less than the time that we're spending on those notes. So note efficiency is going to be important, but I promise you, if you just take the time each and every time you kind of see the patient, then you will find out a little bit more about what they need. And I'll be honest with you, my patients, I reach out to them on secure messaging. So even when I carried a load of, I was seeing 20 patients a day or 15 to 20 patients a day, and this was, when secure messaging wasn't as significant, I made sure that my patients had access to me. I don't mind taking a TCON. I didn't mind emailing them back. But just having that access to you, a lot of patients won't necessarily utilize it until they actually need it. So now that we have MHS Genesis at the end of the appointment, I say, I'm going to send you a message. Please respond to my message. If you need me, contact me. So
Wonderful. Thank you so much, ma'am. Anyone else with any questions?
I see Dr. Onwan here. Not sure if Dr. Ameno is on still.
Hey, Jen, this is Captain Chauffeur. I got a question, if you can hear me okay.
Yes, we can, sir.
Hey, so this is my question for Captain Elmore. If you had a young female physician in your office who was just starting her career in a critical wartime specialty, but at the same time wanted to start a family, what would your general advice be to that female physician? Over.
I would say do it. I was scared. I didn't start my family until I was 37, 38. One, because I did come from a family where men had mental health. I was afraid of that. I was also afraid that if I had a little black boy that he would get killed before the age of 18. And it was my colleagues at Dr. Ansel and Beyonce, because I'm a Beyonce fan, who told me I could do it, and the nurses that I worked with. So if that young woman comes into my office, I will say, do you see how many women around here have done it? And the way we did it is because I had a tribe. People, when you get pregnant, they will support you. All you have to do is say, I'm pregnant, really. But all you have to do is be willing to accept the help. They will support you. And we're in a day and age now where we're seeing women that are running companies and are mothers. All of my CEOs that I've had, they've all been mothers, and their children, varied in age. But the fact that I could see it happen means that she can too. So I'm going to tell everybody, have your baby when you're ready. Don't be afraid. And when you're ready, we're going to be here to take care of you and your child.
Thanks. Appreciate it.
Thanks for the question.
Any other questions at all?
I just have to say thanks to Captain Chauffeur for all the work he's done in transparency. One of the things that women tend to are concerned about is that they're not aware of everything that's going on that allows them to be promotable as warfighters in our U.S. Navy. And all the work that he and the people in his office have done to make things transparent and equitable, I just want to say thanks.
Hey, thanks. Appreciate it.
I see Dr.
I have a Commander Schultes who has his hand raised. I might be pronouncing your name wrong. My apologies.
Hi, Captain Elmore and team. And yes, it's Commander Schultes. Ma'am, I do miss working with you now that I'm over in Pensacola. And thank you for putting on a fantastic lecture. We've got some great people here online too. I'm going to speak on behalf of my wife, who's Navy JAG. And she is actually post-surgery week 3 from a diastasis recti repair that she had at Keesler, who apparently is the Robotic Center of Excellence for DoD. And so they actually did laparoscopic robotic repair of the DR. And that's something that she had very little information on when she went through her 3 pregnancies. And I'm curious if there's a push within women's health, especially postpartum, to really kind of inform the general population and females postpartum about DR and some of the complications that may be not inherent within like 6 weeks postpartum, but really can affect women, 2-3 years later. If she suffered from cystocele, rectocele, other issues too that she's very public about now, and trying to educate those. And I guess there's a group of women postpartum that kind of hang out on the sidelines during PFA and kind of squeeze out the minimum amount of sit-ups because of the core challenges that they have too. So I'm just curious if that's a part of the warfighter discussions and something that we can continue to educate our population on. Over.
Thank you so much. I miss you too. Thank you for bringing this up. So GR is very much talked about when you look at social media. Women are always talking about GR. And there's so many women that experience it. Number one, I think every female should have pelvic floor physical therapy. Every single one of them, especially if you deliver a baby or you carry heavy things or anything like that. I think we need to start there. The reason why is because eventually, there's a significant number of women that are going to have incontinence. Like you said, they're going to have their vaginas coming out, which would be a cystocele or rectocele. They're going to have drooping of the uterus, and they're going to have weakening of their pelvic floor and their abdominal muscles. I think it is crucial that we continue to talk about these things. I think that's why having the Army has the Pregnancy Fit program, our War Ops program. They've been asking me whether or not pregnant women can be a part of that and can they continue post-op. Absolutely. When you have a multidisciplinary approach between your OBGYN, a lot of times your general surgeon, and your physical therapist, we can prevent a lot of these things from happening so that we can, teach women what do you need to do to keep this pelvic floor, this abdominal muscle as healthy as possible. And then when we recognize it and we've done absolutely everything that we can do without surgery, then we have to be able to say, yes, we need to get you this surgery because I don't need your abdominal, I don't need your abdominal wall or incontinence popping out of your belly every time you try to do a sit-up, a push-up, a plank, or whatever. So I thank you for bringing that up. I think it's very important. And in order for us to keep our female warfighter ready, we got to make sure that their pelvic floor is ready as well. Over.
Yes, ma'am. And I think the pelvic floor PT is something my wife kind of learned about 6 months ago that she found very, very helpful too. And I really appreciate you bringing that up too. Thank you, ma'am.
Thank you.
Any other questions from the group or comments?
Hey, Jen, if no one else has one, I have one. I just can't see since I'm driving.
Yeah, go ahead, sir.
Hey, this is my question, and this is a place of honesty. I want to hear the honest truth. What do you think some of the recent changes in Navy medicine, what kind of message is that sending to the female warfighter? Over.
So when you say recent changes, which ones are you talking about? Because there's some great ones that are going on, but there's some that are not so great. Are you talking about the movement to platforms? Are you talking about changes in what are you talking about?
I think in general, I would say what many people would say the shift to readiness, which I think in our core shows a decreased training pipeline for certain specialties that are focused on the female warfighter, namely pediatrics and OBGYN. Over.
Yeah, I'm concerned because, that's a pipeline where you actually get a lot of females involved in the care as well, right? So I am definitely concerned about what that message is sending out. But I think we also have to realize it's not your specialty per se that is don't just wear your specialty on your shoulders or on your collar. Wear your officership on your collar. Because just like we said, for gynecology, it used to be OBGYN because everybody just thought about us as OBGYNs. No, there is a significant need for gynecologic surgeons and people that have a specialty in women's health. There is a specific need that somebody that can take care of a baby or adolescent. And if for some reason we are going down in those numbers, then where's your officership? How can you be of assistance as an officer, not necessarily a medical, a physician as well? So, that's one of the reasons why I changed not only to be a OBGYN, is also to improve my officership. because if you want to stay in, you can always be a leader. The other thing is, in order to keep these things moving forward and people to understand that, you know, your critical care, let me tell you about critical care in both peds as well as GSO. That postpartum hemorrhage, that intubating a baby, that putting lines in a mom or a baby, that handling a, you know, any type of obstetric or GYN emergency, most people cannot do that. So you're giving your corpsmen opportunities, you're giving your nurses opportunities, all this critical care that we do in our MTF, that's opportunities for them to train for those critical wartime specialties. So that's how I look at that. And I just want to tell people, you know what? Choose what your goals are in your job and in your career and your profession, your professional and personal life, and move towards those goals. Stop thinking, oh, they're taking this away, the sky is falling, da-da-da-da-da. Think about, where do I want to be, and how does that align with what's going on? And if it stays with the military, then stay with the military. If it doesn't, then if you get out, make sure you take TRICARE so you can continue taking care of our military families and our active duty members. Over.
That's wonderful, ma'am. Thank you so much. Any other questions or comments from the group? We still have about 5 minutes or so.
Hi, Captain Elmore. This is Monica Armano. More than a question, I just want to give you a comment. I'm sorry, I'm in clinic right now, but thank you for your answer previously. I think normalizing childbirth during child rearing, like just having kids at any point during medical training or as staff, is extremely important for recruitment and retention. Every single time that I mentor young female physicians, that is their number one concern, from medical students all the way to young junior staff. So thank you so much for that answer.
My pleasure. Thank you for leading the way with all of the advocacy work and research and everything that you're doing. The execution of that has been absolutely amazing. And I didn't think I could do it because 10 years ago, there weren't a lot of women in leadership that had children, or 15 years ago. So now that I'm seeing that, and hopefully more people are seeing that, they can see it doesn't matter whether you're in the military or not. You're going to have to make that decision, especially as a medical professional, whether or not and when you're going to have children. So thank you so much. But we got to support each other in doing that. And I'll tell you guys a story, or may know, when I, reached out because I couldn't get my hair done during COVID. She hooked me up, which is huge, and it makes a difference. Those are the little things that we need to do to take care of. And I know it sounds crazy, but, my hair is very important to me, and being able to get it done makes a huge difference. And that is a huge thing for women. So if another thing I can advocate for, you need to make sure that you have resources for all women of all hair types all over the world. And I know that sounds like it shouldn't be important, but it is.
Definitely, ma'am. Any other questions or comments?
Captain Elmore, this is Lieutenant Commander Ong. I want to appreciate your candid stories. And I just wanted to share myself. I had my child at 40, and really appreciate your comments about, plan your family, have your kids when you're ready. And the other part I wanted to add was that, you could catch up on your career. And that's what I'm doing or trying to do here at my turret and MCSD. So, do what's right for you, make the best decisions for your personal life and your career. It's a hard balance, but I think there's enough support in the system that whatever choices you make, I think, our careers or, whichever parts we can recover, we can make it work. And I really appreciate your support. And, not many people on this call know Captain Kane, but I really appreciate my leadership in supporting me and helping me kind of move on in terms of taking on leadership positions and kind of developing myself as a leader. So I wanted to kind of give that shout out to you, Captain Elmore.
Well, thank you so much. And everybody doesn't know, but she's our current interim director of mental health. And that is an amazing, amazing feat because she doesn't have birds on, but that should not matter. Rank does not reflect maturity and ability to lead. And I think that if we're going to continue competing with the Googles and the Apples and all those different people in the world, then we have to realize that people may take time off from their career, they may take non-traditional paths, but their ability to lead is within themselves and how we support them and how we open doors for them. So congratulations, Commander Ong. I'm very proud of you, and I can't wait to see you face-to-face in the boardroom again.
Thank you, ma'am.
You're welcome.
Wonderful. I think we just have a couple more minutes if anyone else has any comments. And I do have to agree, Captain Elmore, that you are just fantastic as a leader. When you were my director of healthcare business at Pendleton many years ago, or not many, a few years ago, it was just having your support was just phenomenal. And you were always there, and you always, anytime I'd come to you with anything, the first thing you'd ask is, how can I help you? Like, what can I do for you? And it's so refreshing and reassuring to have a leader like that when you are, really trying to either stand out from the crowd or kind of make a name for yourself, or really just trying to find ways to make your clinical setting better in some way. So thank you for all that you did for me and continue to do for me, including this lecture. So thank you. But you are really phenomenal. Any other questions or comments? I just want to let the group have anything else. No? All right, wonderful. Well, thank you so much, Captain Elmore. I appreciate your time so much. I know that even preparing for this takes a lot of time, so thank you. We all appreciate everything that you've said today, everything that you've done for all of us. I'm gonna stop the recording now, and thank you so much. If you have anything else to say, please feel free.
Just, I want you to love what you do, who you do it with, and why you are doing each and every day. If myself or any of my colleagues can open doors, break down barriers, break through glass ceilings, concrete, whatever it is, and it doesn't have to always be another woman, it could be a man too. Make sure that you reach out and ask, and whatever we can do for you to make it easier on you so that you can be ready to fight, so that our women can be ready to fight, and our men as well. That's what we're here for. Have a wonderful day. Don't forget to smile and always be ready. Bye-bye.
Thank you so much, ma'am.